Welcome to Public Health in Real Life. My name is Ashwin Kadami. I am a senior global public health professional and your co-host today. Happiness and public health is the topic of this special program to celebrate the International Day of Happiness, which is actually tomorrow, March 20th. You may wonder if happiness stimulates health or if health stimulates happiness. There's research supporting correlation both ways. But what are its implications more broadly for public health? What does the word happiness even mean? What is its relevance during a global pandemic? To discuss further, we are incredibly honored to have Professor Dr. Ruut Veenhoven, who is known as the godfather of happiness studies and a leading authority on the worldwide levels of happiness from country to country. Before I introduce our distinguished guest, I'd like to welcome my friend and co host, Dr. Jasmine Rice. Dr. Rice, could you please start by introducing yourself and setting the stage for us?
Sure. Again, my name is Dr. Jasmine Rice. I am a clinical neuropsychologist at the Memory Care Center of Hartford Healthcare's Ayer Neuroscience Institute in Hartford, Connecticut. And I am, needless to say, happy to be here. A few words on the International Day of Happiness, like Ashwin said, is tomorrow. It is a day to be happy, of course. The United Nations is conscious that the pursuit of happiness is a fundamental human goal. They recognize the relevance of happiness and well-being as universal goals and aspirations in the lives of individuals and around the world. And it is important in their recognition and public policy objectives. The United Nations recognizes also the need for a more inclusive, balanced, and equitable approach to economic growth that promotes sustainable development, poverty eradication, and happiness and well-being to all peoples. The United Nations has celebrated the International Day of Happiness since 2013 as a way to recognize the importance of happiness in the lives of people around the world. And today, again, we are very honored to have Professor Ruut Veenhoven with us today. So over to you, Ashwin.
Thank you so much, Jasmine. Dr. Ruut Veenhoven is Professor Emeritus of Social Conditions of Human Happiness at Erasmus University Rotterdam and is still active at the university in the Erasmus Happiness Economics Research Organization, EHERO. He is also professor at the Northwest University in South Africa, where he's involved in the Optancia Research Program. Professor Veenhoven's current research is on subjective quality of life. Major publications are Conditions of Happiness, Happiness in Nations, The Four Qualities of Life, and Greater Happiness for a Greater Number. Is that possible and desirable? Professor Veenhoven also published on abortion, love, marriage, and parenthood. So Professor Veenhoven is the founder of the World Database of Happiness and of the Journal of Happiness Studies. He earned his doctorate on the dissertation Conditions of Happiness that synthesized results of 245 empirical studies on happiness. On that basis, he developed the World Database of Happiness, which now covers 20,000 research findings taken from 3,500 empirical investigations. Now the number is probably more. Dr. Veenhoven is mentioned in the top 5% of authors in his field. We are incredibly honored to have him on today's program. Welcome, Professor Veenhoven.
Bye. I'm happy to be in the show.
Yes, I'm sure you have been asked this question a billion times, but let me ask you billion first time. How do we define happiness?
Well, I can tell how I define it, and I define it as life satisfaction. If you enjoy the life you live, you're happy.
Okay. Are you happy today?
I am, but make the difference between being happy today, feeling good, and enjoying your life as a whole. So you can be in a bad mood, but still know, all in all, I like the life I live.
Yes, absolutely. There's a lot of content to unpack there, which we will do as we move forward in this program. So, mental health disorders are on the rise globally, and we would like to know what research shows about the correlation between countries investing into mental health care and their average citizen happiness.
Yes, countries differ in how much they spend on healthcare, and they also differ in the share of mental health in the total health budget. And we compared nations and looked whether there is a difference in nations who spend more on mental health. And yes, in these nations, people are happier. Simply saying, the more psychologists per capita in the country, the happier people are. And that may sound strange in the beginning, because it must be misery, otherwise, the psychologists have no clients. But it means that if you have a problem and you go to a psychologist, it typically helps. Uh, Like there is a correlation between the number of physicians in a country and how long people live. And the same thing we see here in the mental health field.
So, do you see increased investments uh, globally on mental health care, or so is the world becoming happier as a result of those investments? Um, so, first, let me start with the first question. Do you see globally an increase in investments in mental health care?
Um, well, when I take the historical view, of course, mental health care has developed over the last 50 years. And it's not only that psychotherapy has developed, but there's also the medication has much improved. And over the last 50 years, at least in the Western countries, happiness is also on the rise. And I think that better mental health care is really one of the factors in this rise. Um, I don't know whether the investment in mental health care has increased, but I do know, more as a sociologist, that in the fight about the health budget, the mental health sector is badly equipped. They don't have the strong pressure groups that some somatic diseases have. As, for example, heart disease, they are very good organized. And they take a big share of the health budget. And if the goal were to maximize happiness, then you better spend more on mental health.
And why do you feel as though the mental health sector does not get the attention or the funding that the somatic or medical sector gets?
That is a matter of organization. And if I take the example of the lobby for heart disease, well, typically among the patients, there are a lot of managers who got a heart problem and support it from the consumer side. Also, the doctors are pretty well organized, and sadly enough, psychologists are seldom trained to build a good lobby.
Fair, fair. Research shows that good health is important, and also mental health is more critical to happiness than physical health. So, how can people be happy? And who are happy people? Are they the people who have a good time every day, or is it more so having a good time long term?
In my definition, happiness is life satisfaction. So we are speaking about the long term. And then why are people happy? Well, of course, that depends on the one hand on the conditions where you live, in the society, but on the other hand, on what you make of your life in these conditions. And since we in modern societies, we live in a multiple choice society, a main driver of our happiness is whether we find a way of life that fits us. And well, here a mental health comes in, because in order to know whether a job fits you or whether a marriage fits you, well, that requires reading your emotions. Well, if you have an emotional problem, you have difficulty in making a good choice. And you, for instance, if you feel lousy all the time, you keep hopping jobs and hopping marriages without getting any better.
Fair. Is, in your opinion, considering everything that's happened with COVID-19, we're now past a year now, just a little bit, do you feel like there's been a dip in happiness around the world?
Yes, well, I was just writing a paper on that. Yes, we see there is a dip, but the dip is surprisingly small. And it's particularly small if you compare it to the publicity. And in the publicity, and the negative effects of the COVID are very much emphasized. And it's a bit like we have seen in happiness research on other disasters, such as floods and even wars. Typically, we can manage external things because it's not our own fault. And so we suffer more on a divorce, because we are part of that, than on a natural disaster. Of course, there are limits to what we can have on external disasters, but well, the COVID situation, at least in well, Western countries, most people can handle that and even experience a kind of challenge. And so it's not only negative effects, and there's also positive effects. It's the new challenges, and well, and some people flourish even better if they are not required to be at the workplace 5 days a week and can spend more time with their family.
Yeah. But in terms, so this is actually my our follow-up question. When the pandemic started, there was public health interventions globally. There were lockdowns in many countries where people got to have the opportunity to have more face time with their family members. With that being the case, still we saw an increase in domestic violence, violence against women, and a series of issues that only negatively impacted families. So, what are your thoughts and observations on that?
Well, I think that it's logical if we are more at home, then that both the positive and the negative effects increase. But the typical case is that we hear more about the negative effects
Sure.
than about the positive.
Sure.
And in a way, that's not bad, because if we know about the negative effects, well, we can at least try to reduce these. But on the other hand, we shouldn't forget that there are also winners in the situation.
Yeah. And in terms of happiness, studies support that happiness not only adds to health, but also adds to productivity and effectiveness at workplace. Should workplaces invest in happiness trainings?
Yes, I very much agree. And in well, organizational science, it generally agreed that satisfied workers are more productive workers. But in the policies, they focus on not life satisfaction, but they focus on job satisfaction.
Sure.
And the surprise of research is that job satisfaction doesn't do so much. No, it's rather life satisfaction.
Mm.
But for a work organization, it's much more difficult to raise life satisfaction than job satisfaction. And if you want to make your workers happier with their life as a whole, well, then you should have interventions, like in the case of health, that go beyond the work floor, but also concern the private lifestyle. And a lot of organizations are reluctant to go into the private sphere of life. And then they limit, well, to appointing a chief happiness officer, who makes the work floor more fun, but the effects are very limited.
Mm. But in terms of life satisfaction, how do you define life satisfaction? And then over to you, Dr. Rice.
Well, life satisfaction is how much you like the life you live. There's no deeper definition required.
Okay.
And the nice thing of the concept is that, well, life satisfaction in that way, that is something we are aware of and is therefore easily measurable using questions.
Sure.
And going back to your point about jobs kind of being a bit leery about getting into the private sector of increasing life satisfaction, let's go broader. How can countries take steps to improve life satisfaction for their residents? And how can they do it alongside public health measures?
Yes, well, there, like in the case of health, that is both environmental and it's individual. If we look at the environmental things, then, well, countries that are economically affluent, well, people are happier there. And in particular, countries that are well organized, that have a good functioning bureaucracy, these countries shape an environment where individual citizens can make their choices. And for that reason, for instance, Denmark is one of the happiest countries in the world. It's an individualistic country with a very good bureaucracy. It was pretty strange for me to realize that bureaucrats can be the angels of happiness, but it's true. Well, on the one hand, a safe, predictable environment. On the other hand, in such an environment, people must be able to make choices and to know what they want, and also to have the guts and to do to choose a way of life which maybe their mother doesn't approve of. And here comes, our education, how we socialize children, how we learn them to know who they are and what they are capable of. And looking at that aspect, it's interesting to see that our education has also changed over the last 50 years. In that era, that happiness went up. Not only psychotherapy developed, but also the way we socialized our children in smaller families, has changed and has made us more capable to make choices in a multiple choice society.
So I'm kind of seeing a theme here. It's sort of a locus of control. If we can make the choice, then it behooves our life satisfaction. But if we have no choice, then it has the opposite effect.
Well, if you have no choice, and well, there's take for instance Japan, which is a wealthy nation, but more collectivistic, and people have less choice. That doesn't say that everybody is unhappy, but the chance that you come to live a life that doesn't really fit you, that you're in the wrong job or with the wrong spouse, yeah, that chance is bigger.
Fair.
Eh?
Okay.
Yeah.
And what are some bottom-up approaches that communities can take to ensure better livability?
Well, typically, we see, well, we need social support, we need nice neighbors, and there should be organizations that facilitate contact. And that's what we see in the data. Societies, but also parts of societies that have these social infrastructures, yeah, their people are typically happier.
Professor Veenhoven, let me confess that I don't like eating spinach or greens, but your research supports that eating healthy adds to happiness. How is it?
Yeah, well, I just checked the available data on that, and there's even experiments where students were encouraged to eat spinach,
Yeah,
and then their mood was recorded every day. Um, and yes, it appears over all these studies that there is a positive effect. And to my surprise,
mm,
that effect is not totally mediated by better health. And I'm still wondering what the independent effect of eating spinach while you don't like it is on long term happiness if it doesn't go through health. So this is a new topic, and I hope that we will see more research on that in the coming years.
sure. And of course, these faulty beliefs that I might have, or usually these are fed by misleading advertisements, and which you say should be counterbalanced with the established fact. So how can societies go about pushing, um, I believe, the industries to change the way they advertise information?
Yeah, what I would like is that something happens. What actually happened in the field of health, you cannot make health claims that are not supported, but at least in some countries that is more or less forbidden. Um, I would like something similar when it comes to claims about happiness. And of course, today, the evidence based for health effects is much better than we have for happiness. But it's just a matter of time that we can also say that some claims for happiness um, do not apply. And for instance, in the case of a car, well, you can buy. In some situation you just need a car, but then the choice is a small car or a big car. Well,
Yeah,
then if you believe the advertisements, you will be much happier in the big car.
yeah,
Well,
yeah,
the data I've seen so far from the US is that it doesn't matter.
right.
So the extra money spent on the bigger car, you could
Yeah,
also spend in a restaurant.
got it, got it. That's cool. So, in terms of when we talk about happiness in the society, something that we see in the news more often, and when we talk to our health colleagues and friends as well, we notice a trend of healthcare workforce burnout, and this has been prevalent even before the pandemic, but now more so. How? What are your thoughts on it in terms of how can hospitals and health systems take steps to prevent global healthcare workforce burnout?
Yeah, well, I'm not a specialist on burnout particularly, but I can frame the problem in a wider context. Um, well, for a lot of societies in the past, boredom was the main problem. Uh, in our society, in our multiple choice society, we can do a lot of nice things. when we can have this nice work, challenging work. There's leisure opportunities, and that makes that we are happier now than the generations in the past. But it also involves the risk of overload. It's like you are in the supermarket, there's so much choice,
Yeah.
you have too much in your basket. And that gives the strange combination. We're typically happy, but there's also, we all experience time pressure, and some people get in a burnout, partly for that reason.
Okay. Um, so treatment strategies can often be selected on the basis of their effects on happiness for the greatest number of patients. How can we do this? How can we reach the greatest number of people and effectively treat them for happiness?
Oh, well, then we should first change the metric used. So in the health field, the metric is health-related quality of life, which is actually the measurement of health and mobility. And I think that we should measure how happy people are, how much they like their life. That was the original idea, but the health psychologists in power in hospitals changed to health-related quality of life. Actually, they call it quality of life. And that is a missed opportunity.
I agree. Actually, in my own practice, I often ask about quality of life, but I never ask, how happy are you? I never truly go into life satisfaction, even though that can definitely inform my practice with my patients. So that's actually something I'm probably going to start today. And if we think of unhappiness as a disease, what percentage of people in the world are unhappy? That might be difficult to answer, but what can we do about unhappiness as a disease model?
I wouldn't call unhappiness a disease. And if you're transformed to hell, you will be unhappy, but not sick. And unhappiness can be, of course, a result of a disease, and physical and mental. Well, and how many people are unhappy? Well, depends much on the country you look at. In say the happiest country in the world, Denmark, I think on a scale from 0 to 10, some I think some 10% scores below 5. But if you go to Africa, which is a sink of unhappiness, yes, that most people are unhappy there.
So, in terms of the United Nations, when Jasmine introduced the International Day of Happiness, she was saying that the United Nations, recognizing the need for more inclusive and equitable world, promotes sustainable development, poverty eradication, happiness, and well-being. So, looks like, according to United Nations, more equal societies can promote happiness. But in your research, you say that the argument is that inequality is not bad in and of itself. Uh, but looks like more so often we see inequality and happiness, they go hand in hand. When there's inequality in the society, people tend to be unhappy as a result of it, right?
Yeah, well, it depends on what inequality in what. If we look at income inequality, there are positive and negative effects to income differences in countries. Of course, if you live in a country where most people live in slums and a few in villas, well, that depresses at least the happiness of the people living in slums. But on the other hand, if there is a class of entrepreneurs who can make profits and who can advance, that also gives hope, and in a lot of situations also the opportunity to improve yourself and to engage. So it depends. In an open society where people can get better, yes, there the positive effects prevail. But if there is actually a caste society and you never will get better than you are, well, then the effect is negative. Well, so much for the income inequality.
Sure. Yeah,
There's
that makes
also
sense.
gender equality. And in the case of gender equality, we see a clear positive effect, which is understandable if you realize that how happy you are, well, depends on the degree to which you can find a way of life that fits you. Well, and not every woman is fitted to the life as a housewife. Well, and in societies where there is gender equality, well, then you can also choose another way of life. There's some cost in choosing, but if we look at the overall effects, that's typically positive.
Makes sense. So before we move on to the other questions, we have an audience comment, a question actually. So we know happiness is a relative factor. Is there any data that shows a person has been happy majority of his or her lifetime?
Um, well, I don't think that happiness is very relative. Of course, in some respects, and when we decide how happy we are, um, we compare our life as it is to the life we would like, and in assessing the life we would like, we also look at what is possible in other people. And so I would call that, well, intellectual happiness.
Mhm.
But our happiness, how satisfied we are with our life, depends much more on how happy we feel, which is more a matter of the degree to which our innate universal needs are met, rather than how we do comparative to the Jones.
So thank you for that, Professor Veenhoven. And in the modern society, you say that hedonistic enjoyment is valued in the modern society
Yeah.
more than other types of enjoyment, and people are actually lacking the ability to enjoy. So how do people develop a sense of enjoyment, the capacity to enjoy, and going um, further than hedonistic enjoyment?
Well, what is you mean that hedonistic enjoyment is just sensory enjoyment, sex and beer?
Well, it looks like it's not only that, right? It can be so in terms of how do people kind of gain the ability to enjoy. Um, there you say that techniques to help people to gain the ability to enjoy are underdeveloped. So how can we develop that skill and technique?
We can at least learn people, and make them try certain activities, such as in music,
Mhm.
in culture, and in sports. So we have an innate ability to enjoy, but we must learn how to enjoy. And that is a process of trial and error. And well, typically in the way we socialize our children, and we have birthday parties, we do a lot of nice things. And cultures that are open for these nice things, well,
So,
better train their members to enjoy. And well, if you happen to live in a society where people think that, God forbids, that you enjoy because you are a sinner and you're here on earth, to repent. Well, then these people will not develop the capability to enjoy very much and be less happy as a result,
Right.
which actually we see in the data.
Yes, yes. Because I was asking this question primarily because we know that happiness can stimulate health, and we really want to highlight which kind of happiness can promote health versus which kind of happiness cannot promote health.
Well, the kind of happiness remains the same, and that is satisfaction with life. But I think, yes, in health promotion, it would be good that we also emphasize the art of living, and the ways to enjoy life. Whereas at the moment, the emphasis is very much on what you should not do. You should not drink, you should not smoke. We can also do it in the positive way. And if we add, the positive to the existing restrictions for the case of health, then I think we will have a better effect.
Gotcha.
And although we might have had this small dip in happiness because of the pandemic, but not as much as we thought, apparently. Overall, do you think that the world is becoming happier?
Yes, if we take the historical view, then definitely we are happier in the modern, say, industrial society than people were in the earlier agrarian, say, feudal society. And if we go further in the history and we go to the phase of hunter-gatherers, then there is some evidence that in that kind of society, actually the kind of society in which the human species evolved, that people were pretty happy. Well, we are not really sure because we cannot ask them, but at least in the study of human remains, we can see that, in the past, Adam and Eve, that they lived short but pretty healthy lives. And we know that when social progress set in, the plow was invented and people came to live in villages and stored food, that social progress didn't make us life much better. No, actually, the feudal times and the agrarian phase of human society is a deep, and from which we recovered after the Industrial Revolution. And science, we live not only longer, but we also come to live happier. And the line is still going up.
Okay. We kind of touched on this a little bit, but do you feel like, I guess the community or the government that the individual is a part of, do you feel as though that contributes to their happiness? Or if we want to speak primarily for government, is there a partisan view to happiness?
And the question is, how does it work? It is so if the sense of community in itself can add a bit, but people can also identify very much with a society that actually doesn't make them much happier. For instance, we see that the willingness to die for the country is greater in the less happy countries. I think the mechanism is rather that if we feel connected, that there is a society that is responsive to the human needs, and that provides the environment in which people can live their own life.
Wonderful.
So, Professor, when we were just curious, is there a leader that you admire?
The best is the philosopher Jeremy Bentham.
Okay.
He was one of the spokesmen of the European intellectual enlightenment by the end of the 18th century. And he the saying that we should go for greater happiness of a greater number of people, and that should be the moral lead, both of individuals and of governments. Yes, he formulated that, and that much inspires me.
And what is your vision for this planet?
The planet is in danger, and I'm happy that we realize that, but we really have a problem. And I realize that, the sustaining Mother Earth can go at the cost of happiness. And, if our life depends on Mother Earth, so if required, we should sacrifice a bit of our happiness on the altar of sustainability.
Got it. And in terms of there are a lot of young people watching this show. So, what is your advice, life advice to young people?
It's good to be happy, and you can be happy without being egoistic. And to be happy, it requires a lot of trial and error. And use the time that you're young and not yet bound by family or job to try out a lot of things, and that will learn you what fits you best.
Gotcha. And can you touch a little bit about a lot of happiness research says an easy way to become happy is to give. Whether you volunteer your time or share your skills. Could you touch a little bit about the relationship between altruism and happiness?
Yes. Well, if you feel happy, you tend to be more open for other people. You're more empathic, and and then you need the money less to be happy. So happy people give more, and yes, typically you get something in return. Not always, but if you give to one person, the person may help you on another occasion, or at least create a climate in which people support each other, and that is also good for everybody's happiness.
Right. And in terms of public health, because our channel is really focused on public health in real life, what are maybe the most, at least if you can name one area where public health can make a better application of happiness to better the community?
I think that there are advancements made in positive psychology, and a lot of trainings have developed, and also happiness trainings. And we did a research synthesis on that, and yes, most of them work. The effect is not dramatic. Typically, some 5% raise
Sure.
on the happiness scale, but given the cost, it's quite effective. So I think that happiness trainings should get a bigger place in preventive health care.
Got it. Got it. Well, Professor Veenhoven, it was a pleasure talking to you today and learning about how happiness really stimulates health and all its um, dimensions. Having this wonderful, I really enjoyed the conversation, learned a lot. Over to you, Jasmine, for a few words.
Same. Thank you so much. It's been very insightful. And as I already said, it's kind of already informed my practice today. So thank you again for your time.
Well, and thank you for the opportunity to talk about my passion.
Great.
Absolutely. Well, we thank all our audience as well, and we look forward to seeing you again. Thank you so much.